We'll drop the link for that also into the chat in a little while. But today we're excited to share with you Dr. Kolovos, because he is just a phenomenal physician. And I have been very blessed to have gotten to work with him a lot over the last couple of years. He's a board certified in emergency medicine, and he received his undergraduate degree in biology from Florida International in Miami. And he got his doctor of medicine from the University of Miami in Miami School of Medicine, and he had a residency in St. Vincent's Medical Centers up in Toledo, Ohio. Currently, he is our medical director and chief experience officer for our BayCare medical group. He goes out and does a fair amount of speaking for us. He has such a dynamic way and a great perspective on health and well-being and just overall how to live a happier, better life. So I am going to turn this over to Dr. Kolovos and let him share with you. We're going to drop that, like I said, there will be a couple of polls for you. We're going to drop that first poll in to start you off. So if you want to answer that for us as we're getting started, it helps us kind of make sure the poll's working. All right, all yours, Dr. Kolovos.
Thank you, Jean Marie. And hey, good morning, everyone. Thank you so much for having us out here to talk with you today. This is one of the highlights of what I get to do in my career is talking with folks. Love to meet you all in person, but I know those are somewhat challenging times. I want to talk to you a little bit today about the benefits of the patient experience, basically your experience with your physician and how your physician and you can have a better working relationship. But I also want to give some reminders out there about our workplace environment. And how the climate of the workplace has changed, not only for you, but for us as well in the medical community. And then finally, I just want to remind everyone that physicians are people too. The art of medicine. Well, for much of my life, my sole identity was based on my occupation as a doctor. My roles as father, husband, son, brother, and friend were secondary to this primary calling. I missed my children's plays, school dances, and sporting events. This calling to be a physician demanded more than 12 years of education and training to perform my job well, while all the while putting family, friends, and my personal life on hold. I did this all with the hope that I could make a difference in other people's lives. Over the past 30 years of my career, I've seen the respect for the medical profession dissipate to some extent. The recent COVID-19 pandemic really brought to light people's true colors for the medical community. Yes, at first, we were called heroes, but public expectations soon changed. The demands for access, the demands that physicians be on call day and night, the wanting to be able to connect with your physician anytime you could. In fact, a simple office visit for a cold would turn into a list of chronic medical complaints. Few people understood or even knew what the health insurance coverage they had would actually cover. And those folks would share their frustration with who else? Not the physician, but to that lowly secretary or medical registration person at the front desk of most clinics. Health insurance companies over the last 2 decades have taken over the practice of medicine, while physicians have been asked to reduce cost, increase access, and improve quality of care. Do you know that when your doctor recommends you for a screening colonoscopy, a mammography, or I ask you to take medication to help with your diabetes, your high cholesterol, or your high blood pressure, that if you don't follow that advice, if you don't seek out those screening exams or take those medications, the doctor is financially dinged by the insurance company. How about that? So as we look through this, some of the challenges are, what are the expectations that people really expect of their physician when they meet with them? Well, I'll tell you what we expect here at BayCare, because these extend to the values that we share among all of our team members. I know that you need to be listened to, and we should take the time to listen to you. I know that you need to receive clear explanation of instructions about your condition, and we'll do everything we can to do that. In fact, I go one step further with my patients. I not only talk to them about their disease, but we also set up expectations. Those expectations being very simply, let's say you come in and I think you have a virus. An antibiotic isn't going to fix that. So I tell you, you got a virus, we're going to watch it. If you have a high fever, the cough changes, or this or this or this change, I want you to come back into the office. We'll take another look. Maybe at that time you'll need a chest x-ray. Maybe you'll need an antibiotic. Maybe we'll need to do something different, so that you always have an understanding of what are the next steps that are going to happen. You want to be treated by staff who show care, concern, and compassion. That's something all of us would expect. And you want to be treated by staff who are professional in their work. And those are the things that we really strive for here at BayCare. And I hope that you always find that those are recognized. However, have patient expectations changed? Let's face it, we now are in an environment where patients are now called customers. That was really difficult for me to get used to some 20 years ago, as I always thought the term patient was far more intimate than calling someone my customer. We're faced with Google reviews, both good and bad, at the mercy of those reviews, and nothing that can really be done about them. We've all eaten at a poor restaurant and given a Yelp review that wasn't probably the most pleasant in the world, right? Well, those same types of reviews come in on physicians' backs as well. Complex insurance plans that, I'll be honest with you, after 30 years of practice and my own insurance plan, I barely understand it. So there's no understanding of why we've gotten into that situation. The increased work hours are something that we've all grown accustomed to. But I think this is probably one of the pieces that's most important, the connectivity. The digital connectivity has always put us on call, not just the physicians, but you as well as workers. Let's face it, cell phones, emails, internet, text messaging, social media. How many of you are connected to all of those pieces of time? They all put us out there a lot more than we did in the past. There's been a removal of our slack time, and we'll talk a little bit more about that in just a second. And then I can't speak for most industries, but in the healthcare industry, there is always the threat of somebody filing a suit against you for some reason or another. It lays over every physician and provider's head, and that causes a lot of stress as well. You know, sociologist George Ritzer coined the term McDonaldization, which invokes the famous fast food chain that I show here in a picture, founded by Ray Kroc in 1955. Kroc really, when he created this, it was what? You got a hot, fast meal very quickly, paper bag, go eat it in your car kind of thing, right? Well, that McDonaldization is what we've gone throughout our entire industry. As a matter of fact, think of the US Postal Service. When's the last time you actually sent a letter or received something through them? Nowadays, everybody is going through what? The digital connectivity that they have before their hand. You've got more control on your phone to access your bank accounts and credit card accounts than anything else out there. More importantly, when you order things online, what do you think made Amazon a multi-billion-dollar company? It's because I could order things online and get it tomorrow, today, or within the next few hours. It was that efficiency that has translated across even into the medical world of today. Patients come in and they expect that same efficiency. Unfortunately, the burdens of technology have not kept up within the medical arena. We're challenged with the administrative burdens of our electronic medical records, which were supposed to be the panacea, connect everybody, right? I could share your medical record with another physician across the way. Well, let me tell you, folks, nothing could be further from the truth. It's very, very challenging for any of those types of demeanors. But are we getting into that McDonaldization period of time? Is this where we're really headed? And is this what we really are looking forward to? I want to jump back in time a little bit, because how did all of this start, right? First, when we think about it, let's take you back to the roaring 30s. World War I is over. The Spanish flu/epidemic of 1918 has just ended, and the economy is finally on its way out of the Great Depression. Jobs are abundant, and the average worker is putting in a solid 47 hours a week. 47 hours a week. That's good stuff. Jump forward 40 years to the 1970s, and automation has helped to shave almost 10 hours off our time working. The average professional in the 1970s was putting in just 39 hours a work week, and they were very happy and satisfied with that. But then a funny thing happens. The downward work trend stopped. By 1986, the phrase work-life balance had been introduced into many US publications. And 20 years later, in 2008, Harvard Business School survey found that 94% of professionals report working more than 50 hours a week, while nearly half say they're putting in about 65 or more hours a week. So what happened? Instead of working towards the balanced life, we started to fill our days with more work. Not only is this level of workaholism unproductive, it's a disease that poisons our personal and professional lives, leading to stress, burnout, and a loss of meaning in the work that we do. When you think about it, look at this slide. Are you working longer hours? Do you feel like you can't turn off at the end of the day? Do you tie your personal worth solely to your work success? Are you finding your relationship strained, your life being negatively impacted, especially your health? Do you ignore hobbies and activities outside of work that bring you joy? Do you always feel behind no matter how much time you put in? These are the challenges that we're facing today throughout our workforce in the United States. When I look back in medicine, I thought maybe we'd be immune to some of this, but we're not. These changing societal pressures and influences are affecting us in medicine as well. Patients and physicians alike can seem to attest to the fact that the average time a doctor spends with each patient has been getting shorter over recent years. Do you feel that same way, that you don't have the time that you once did with your doctor, that it seems like it's a much quicker in and out kind of experience? Well, decreasing reimbursements have forced physicians to see more patients to retain the same amount of income. That means shorter patient visits with less time for relationship building. I got into medicine because I loved the science and I loved what I did and I loved meeting people every day. As an emergency medicine physician, I got to tell you, I was meeting people by accident every day that I worked. But the reality with it was did we really see a decreased time frame in which we were spending with patients? Well, as much as you might want to think it's otherwise, actual time spent with patients is about 13 to 16 minutes during a visit. And that has been the time forever. Nobody's ever really been above or below that time. So we've kind of continued with that. The problem with it really lies in that doctors are spending more time than ever on documentation and administrative tasks that are leading to their dissatisfaction and to their professional burnout. This was an interesting study that was by Dr. Justin Porter out of the University of Chicago. He looked at this and he said a primary care physician would need an average of 27 hours a day just to be able to provide preventative, chronic disease, and acute care for a typical panel of adult patients. There are literally not enough hours in a single day for a primary care physician to fulfill the gamut of basic guideline-based care, according to this particular study. When you start to think about all of this, the things we have to be challenged with are that we know that when we work too many hours, is it a bad thing, right? Professional issues. Well, we see folks getting stressed and burned out, losing a sense of meaning found in their work. On the personal side, we have the strained mental relationships. We have the mental health issues. We have lower satisfaction in life in general, and we're just kind of bitter and angry at times. When you think about it, everybody wants to say, well, let's do more work, let's get the job done, and we'll all feel better for it, right? The ironic part of all of this is that studies have shown us that extended working hours don't necessarily make us more productive. In fact, did you know that anything beyond 49 hours a work week can have a negative impact on productivity? In fact, one study found that that working more than 50 hours a week showed a very marginal increase in productivity among workers. For all of you, and Jean Marie may be able to put this poll up, I just got to ask you, how many hours a week do you work? Are you doing a 40-hour week? Are you working 41 to 50 hours a week? Or are you working more than 50 hours a week? Take a minute and do that poll while I continue on through this. When you think about all of that, what I want you to bear in mind is this. There is actually, when you take somebody who works 50 hours a week or 70 hours a week, there is no difference in their productivity. In fact, there's only a very marginal increase in a person's productivity after 49 hours in a work week. So if you're an employer and you've got somebody working 70 hours a week for you, congratulations. You're getting 40 hours of productivity out of somebody that you're paying 70 hours of work for. Something just to keep in mind. So some of you may be saying, Nick, that's not true. You know, we make widgets and those widgets come off the end of the assembly line, and the more widgets that come off, the more money we make, the higher the stock price goes. I get it. So you're not convinced. The work hours increase don't lead to decreased productivity. Well, what would you say if I told you that working an average of 55 hours or more each week increases your risk for stroke by 35% and your risk of dying from heart disease by 17%? Does that get your attention? Because it certainly got my attention when I started looking at some of this data and research. We know that anything over 45 hours a week is really detrimental to the physical and mental health. Lower productivity does occur, burnout occurs, and there's an increased risk of both stroke and death from heart disease. So we buried you with the bad news. We're all working more. We all can't disconnect. What do we do about it? Well, you've got to kind of reframe your perspective on your job. You know, 8 out of 10 workers don't feel engaged. And the lack of engagement by a worker really ends up causing them to have less energy. There's no difference between the workforce and the healthcare force. We both feel that same way. There's so much potential that remains unfulfilled. You know, some have estimated the loss in human terms of unfulfilled economic potential is estimated at almost $7 trillion of lost productivity every year for both physicians, providers, workers, anyone out there where they're not engaged within their workforce. Business units that are the most engaged are at 17% more productive and 21% more profitable. So if you have a group of folks that are really engaged in what they do, they've got a commitment to what they do, the bottom line is you're going to see an improvement in both productivity in their lives as well as potential stock price. Imagine what we would become if instead of less than 20% of employees being engaged, 80% of people gave their very best. Let me give you a little story now as we talk about some of this reframing, because when I talk about reframing, it's really about you finding your personal purpose to what you do. What gives you joy and drives you at that workplace, and what connects personal and company purpose. Small story out of the Middle Ages. Two masons during the Middle Ages, they're both performing the same task, and they were asked about their work. The first one, "Don't you see I'm cutting stones," said the first one. Whereas the second took an entirely different view. "I'm building a cathedral," he said. What do you think about the impression of those two stonemasons? Which one do you think is more engaged with the work that they're doing? Probably the latter. Applying this applying this very human sense of purpose to work changes how we approach it and therefore how we engage in it. And so I want you to bear that in mind. We really have to take a little different look in order to help each other become engaged within our work. Behaviors that everyone can implement are relatively simple. We'll go through dark periods from time to time. We all have done that. We've all had that depressing day. But do you know the steps that you can take to turn a bad day around and start new? They're really relatively simple. There are 3 things that you can do, and I'm going to tell each of you what those are. 1, connection. 2, movement. And 3, gratitude. It all starts with connecting with others, with ourselves, and how we connect through our daily encounters. You know, the first thing I always try to do in the morning is say hello to folks. When I come in to the office and I'm speaking with folks, I just want to sit down and say hello to them, see how they're doing for their particular day. This is a connection for me personally. Yes, I care about what they're doing and where they're going, but I need that human contact and that human connection. Simply do something or say something nice for someone else. This connection to others is a great way of you getting out of a depressed state of mind. And it kind of releases some of those happy hormones that make us all feel better throughout the day. The term social distancing has been very confusing, was a very confusing position statement used over the past 2 years in the midst of COVID. This silly term should have been called physical distancing. After all, the real message was to encourage people to have some physical distance between one another. However, fear drove people away from one another. They avoided socializing with one another. As a result, people became disconnected from one another. They felt alone, thinking no one loved them or cared about them, and they lost their connection. This is pretty tragic when we think about it. And we have folks that are still today in that same mindset. So we have to kind of take a step back and see what can we do differently. Well, as I said, step one, connect with someone. Say something nice or do something nice for someone. Step two, movement. Moving the body is so important to elevating a person's mood. When we're in a down mood, we don't want to move the body at all. But just going for a walk, seeing a random dog, a neighbor, or a hello to someone releases those happy hormones. So you must move. Take an opportunity during the day to have a break where you and maybe some of your colleagues just walk around the building, or just walk out to the parking lot and walk back. This doesn't need to be a 26-mile marathon. I'm not trying to get you to be a triathlete. It's just getting out of the work environment to try to re-excite yourself and reconnect. The last one, and it's a real important one, is gratitude. An attitude of gratitude is the best medicine for the soul. And it seems so cliche, but if you sit there and you write down today 3 things that you're grateful for, and you do this every day for the next week, you'll improve your mood and your day, because changing your mindset is just so crucial to having a better day. Think about this. If you do this for just 2 weeks, it will actually enhance your mood for the next 6 months. It has a very lasting residual effect. And let me just tell you, happy people live longer. When we think about some of these other things, I look at things like meetings and reducing meeting times. Did you and anyone here aware of the rule of 7 when it comes to meetings? Hopefully you are. But if you're not, don't worry. I'll explain it. To make a decision, you have to invite people to a group sometimes, right? And you want to make a decision. Well, inviting too many people is a sure way not to decide anything at all. The rule of 7 basically says that to protect a small, you really want to protect the small attendee list. You don't want to have more than about 7 people in a meeting where you actually have to make a decision. Because guess what? The likelihood of arriving at a good decision decreases by 10% for every participant over 7. So if you put 17 people in a meeting, the odds are that you're not going to make any decision at all for that particular meeting. So reduce the meeting. I also reduce meeting times. I rarely have meetings that last more than 30 minutes, and I always want to give people back the gift of time. Shorter meetings, meaning I'm really forced to an agenda. Now, we're not talking about the meetings where a CEO or leadership are announcing a plan or a movement for the entire organization. We're talking about those meetings where you're really trying to make a decision about something. And those are where you really want to kind of regain some of your time, some of that slack time that we've lost because of all of the connectivity we have with our society. Kind of reassess some of your expectations on procedures. You would be shocked to find the amount of waste that we have when we're doing certain procedures every day. And if we just remove some of that waste, we actually enhance efficiency without putting any more work or burden on anyone. So just something to be aware of. I want you to invest in your healthcare. That doesn't mean buying another insurance plan. What it really means is you've got to take time for yourself. Make wellness a priority. I like to go fishing. That's my relaxation. I don't even care if I catch any fish that particular day, but you've got to do the things that make you feel well and make you feel well rested. And then finally, enforce hours off. It's okay to disconnect. You will never get an email from me after 5 o'clock on any workday, and you will not get an email from me on any weekend or holiday. I tell all of the folks that report to me that they can certainly send me their emails, but as a leader, I'm not going to send it to them. I'm going to respect their time off. I learned this lesson when I was at another organization. It was about 2 in the morning. I was working on a project and I came up and I said, "Oh, I really need this particular thing." So without thinking, I shot an email off to an individual that was working on my team that I knew would have the answer for it. 4 o'clock in the morning, I get an email saying, "Hey, here's your answer, Dr. Kolovas." I was embarrassed by that. I disrupted this individual's off time, his sleep time, so that they would go and answer my email. That's crazy. So on those really important emails that I need something on, I might send it on the weekend with a delay so it doesn't arrive until Monday. And I always put in the subject heading, no answer needed before Monday, and I give a specific date. That way somebody sees it on their phone and, oh, I don't have to get to this till Monday. Respect people's time, allow them and help them to disconnect. So we've talked about a lot of things about the work environment and how it's changed dramatically over the last 2 decades. And particularly over the last several years, it's even gotten worse. Staffing shortages are throughout. We are no different. The healthcare industry is extremely tight staffed right now, and we're having those challenges. But what can you do that will enhance your experience with your physician and help to bond that physician-patient relationship? Well, I want you to take home a few tips. Connect with your caregiver and their staff. Say something nice to them. A simple good morning. How is your day? That sweater looks very nice on you. Remember, this is the connection that not only benefits you, but it can give them a huge lift as well. Focus on a singular problem during your visit or an issue. Don't come in and say, hey, I've got an ear pain, but I have a list of chronic medical issues I need you to look at as well. It just won't be an efficient visit. Deal with the singular problem. If you have to, write it down. If you have an advocate that can come with you to the visit, bring them along so that they can help focus you on that singular visit, on that singular problem. Now, you need to follow your physician's advice on preventative testing. It's not because I'm worried about getting dinged by the insurance company, but what I really care about and what really frustrates physicians is that I know what I can do to help you. And when you don't take that advantage of getting that help, it frustrates me. And that frustration is because I care about you. And that's how we feel here at BayCare about all of our patients. Colonoscopy screening, mammography screening, eye exam screening. If you're on a medication and it doesn't agree with you, tell your physician. There's other options in many cases. Take your medications as prescribed. That's extremely important. And I tell everyone this, have a list of your medications with you. Just put it in your wallet because you're going to get asked those every time you go and check in with a provider. It's not that they've forgotten, but they're required to recheck and see what's going on. Has anything changed? And lastly, be considerate of the physician's time to respond to your portal messages, calls, emails, and texts. I speak to my physicians here at BayCare, and I see several of them through portal messaging. Portal messaging is not text messaging. It may be a day or two before they get to it, but they make every effort here to get to them in a timely fashion. The calls that come into offices, we're inundated with those calls, and it can be extremely challenging. So be patient with the staff. It's not their fault. Emails and texting, I always tell people really curb that. There's a lot through emails we can't send you just because we're trying to make sure we're protecting your personal information. So I'm going to leave you with a final thought, and then we'll ask some questions. Applying this very human sense of purpose to work changes how we approach it and therefore how much we engage in it. Does it make work always easy and always fun? No, everyone has bad days. Every job comes with its challenges. A personal sense of purpose is not in and of itself the only thing that fires people up at work. But being able to connect what we do every day with a bigger sense of why we do it helps infuse us humans with energy, drive, and direction. And this is a good start, whether you are a physician, patient, or brick mason. The benefits to your patient experience and your personal well-being, just always remember, you can't go back and change the beginning, but you can start where you are and change the ending. On behalf of BayCare, I want to thank all of you for giving us the opportunity to come and meet and speak with you today. I hope you share these same values that we have within our organization, and we'll take some questions, Jean Marie.
Awesome. Let me get the recording off and pull up stuff. I see all the little hearts of the hands. I have to say, you always speak to my love language. I love to hear the things that you say because there's such great things. Common sense kind of activities. And I want to give you a little kudo as I turn off the mic so I can turn on the mics for everyone. Is Dr. Kolovos really, he runs this 10-month program for our physicians to onboard them into BayCare and looking at them holistically as a person and the different pieces, whether you're a doctor or a bricklayer or whatever position, they work kind of for everybody. And it's just kind of exciting to see the things that you're trying to bring to the community and the thoughts that you're bringing here with us. So why am I?
I see a hand up, or there
Yes,
was a
we see
hand
a
up.
hand up. And there's always a challenge, isn't there? I am trying to get to the meeting thing to let me turn on the mics. I think I have to go through a different area. If you can type in your question, we will ask that first, and I will keep working on getting the mics opened up.
Okay.
So in the chat,
Thank you. I appreciate that.
So it's great to hear all the tips and reminders to be responsible for self-care. Prevention is so important and being able to take care of ourselves. You gave us some great tips on that.
That's the key with everything, folks. As you look, there's all kinds of things that are out there, but my real challenge to all of you is this. Over the next 30 days, figure out a challenge for yourself. Where do you want to be? How are you going to get there? And are you willing to change to make that journey? And that could be staying within the job that you're at, looking for something different, whatever it is. But you want to try to make that because you're the only one that's going to be able to impact or make that change. So I appreciate all of the thank yous on the presentation. I hope you enjoyed it. If you have any questions, please just raise your hand or type it in the chat. We're happy to try to answer it for you.
Yeah. The nice thing is, if you're looking at our poll also, because I always think if you put a poll and you want to kind of respond to it, we only had 13% of our group who actually works 51 hours or more.
Yeah, that's still quite a bit, right? Because remember, after 49 hours, our productivity isn't that significant. And part of that is think about the time that's been removed from your day over the last 10, 15, 20 years. Used to be a time when I could go from meeting to meeting, there was time between them, but now it's just one after the other after the other. We really removed the slack time from our daily events. And that slack time gave us that little bit of time to just kind of re-energize and recharge. So that's the things that we have to kind of regain within our life to keep us balanced, I would say.
We have a question in here now. It's thank you so much for your time. You mentioned that doctors get financially dinged if their patients do not follow through on preventative treatment. Did that have an overall impact on the rates that doctors charge?
No, it really doesn't. What it is you're going to hear a lot, and if you haven't heard already, the value care medicine proposal, right? Those propositions are the things that, and that's why as physicians, our frustration isn't that I'm losing something financially. My frustration is that I care about you and I want you to get better, and I don't know how to make that happen. Insurance companies look at these things. If you're not getting your screening exams, if you're not taking your medications, if you do these things that you're not supposed to be doing, what happens is the quality of care goes down. And that can affect a healthcare institution. It can affect the patients. It can affect a host of people. And typically, the way that's done is through a financial burden that an organization has to sustain. So we care not from the fact that we're losing any money from that. What I really mean by that is our frustration as providers is the fact that if I get it with my kids all the time, and I get it with my family members. They come in, they'll ask me, "Hey, I got this going on. What should I do?" And I'll say, "Well, you should do this." And they don't do it, and they come back to me 2 weeks later. It's not any better. So, did you do what I said? No. Well, let's try to do that, and they still don't do it. And I get frustrated because I'm like, I care about you. I want you to be better. You just got to listen and do what I'm asking you to do. Now, if there's a problem, maybe you can't get to the pharmacy. Maybe the cost of the medicine is too expensive. Any of these types of barriers arise, we just need to know about it because we may have some solutions for that, and we're always looking for those. So that's the real purpose behind that. And you're going to find that that's a challenge for physicians. If I tell you get your colonoscopy and you don't get your colonoscopy, on my end of the records, it looks like I didn't do a good job as a physician because I don't get credit for it if you don't do it. So that's a big hit.
A lot more things going in there, and I did fix the mic issue. So if you do have a question, you can raise your hand and we can take you off mute. But everyone is kind of saying thank you. And that preventative care, I think that's so important. Yes, it's so important to do your early detection and make sure you're getting that relationship with your doctor, because that helps to give you the right paths and a partner to kind of go on this path. But you gave us a lot of great examples of just things that you can do simply each day to help create real prevention in your life and build that wellness up. We do have a
Absolutely. Absolutely. And I think, Jean Marie, I see the question, how do you get your employees to do their preventive care? I worked with an organization in Pennsylvania. I won't give any specific names, protect the innocent, as they say, but I had the same opportunity with the organization. They were concerned about it. So what was really created by the organization, absolute kudos to them, was they required all of their employees to get their standard preventative examination and their standard blood work and all of that kind of stuff. And that's important because early diagnosis can actually cause the prevention of some of these diseases, or at least curtail them to some extent. And so what the employer did was, if you went and you got your blood work and you got your preventative exam, you did this thing, you got 2 days paid time off added to your calendar. And at first, when I mentioned that to the employer, they're like, that's going to be kind of costly. Turned out that they saved so much money by doing the preventative stuff that the 2 days off was like a nothing. And the way they saved the money was they were able to go to their insurance carrier and go, hey, look, we did all this preventative stuff. And the insurance carrier recognized it and said, yeah, we're going to reduce your rates because you're taking care of your people. So there's a residual benefit to it all the way. More importantly, all of their employees were being very well taken care of, and the early recognition of some of the diseases were being addressed: high blood pressure, high cholesterol, these types of things that we can actually manage and do some things with. So there's some real benefits to it. Just have to kind of think a little outside the box sometimes on these things.
If my physician retires, because that happened to me also this year, as if it's someone else on our list, what do you do to try and what's the best way to find that new physician, to be able to find someone to pick up where they left off so you can keep that continuum of care?
Yeah, if you're in our local area, BayCare has a tremendous number of resources online for new physicians. Typically, if your physician retires, they'll often give you a referral to somebody that may be taking over the patients in their particular practice. That sometimes happens. I'm a big fan of making sure you kind of check out the physicians. And my family, I've taught them this forever. They'll go see a physician. We use all BayCare physicians, and if you don't like the particular position, maybe you just don't get along or what have you, it's okay to change and go to someone else. Now, you don't want to jump around everybody, because that isn't probably a prudent measure, but when you go in and you connect with somebody. And I can tell you, seeing a number of the physicians that I've worked with personally and professionally within BayCare, I'm happy with all of the folks I've come across to date, and I hope you will be as well. But that's what I would do, is I would connect through those online resources. When in doubt, you can always go to your insurance plan and ask them, what physicians do they have in the area that are taking your insurance? That's a real key, right? Because you don't want to go out of network, because if you do, that could be very, very costly. So asking your insurance plan to give you a list of providers that are accepting new patients in your area that are taking your plan. That's a really quick way of trying to figure it out as well. And like I said, we've got some resources up there for BayCare if you're in the area here.
And Claudia, thank you. You put a phone number in, and I am dropping the web link in if anyone is looking for that. And I think you made a really good point that people, don't always think about. It's, if you don't find that connection, you don't feel that close relationship, it doesn't mean that it's a bad doctor or that they're not a
Right.
good person. It just might be that you don't have that connection. And this is an intimate relationship, and you do want to have a relationship, someone you feel comfortable being able to tell things to, because when you go to the doctor, you need to tell them everything. Otherwise, they can't really help you. So it is important that you take the time to, try and create that relationship and have that ability to have that person you trust and can talk to.
And whenever you visit your physician, I know I don't always do it. My wife doesn't always do it, but we did it with our kids. And I recommend those that are out there, if you have someone that can go with you to the visit, a significant other, what have you, that's important in some cases because they can be an advocate for you. They can also, hey, remember you wanted this, you didn't mention this, or you take this medication, you didn't mention that. So having that, I always recommend to all of you, keep a copy of your most recent laboratory work, your EKG if you had one done, as well as your list of medications and allergies with you at all times. That's extremely important information. As an ER physician, I can tell you right now, if you came into the emergency department, you were sick and you were unconscious and we couldn't figure anything out, we're going to go through, figure out what your name is. We're going to start doing a search, figure out where you were last seen. And then if we, by chance, are able to get records on you, it will probably be in about 24 to 48 hours, sometimes well beyond the time of when we needed them. So having that information on you, particularly if you're traveling, is extremely important. Very accessible. You can put it on small little cards and put it in your wallet or in your purse. That information can really help expedite care and treatment in emergency situations.
One of our awesome brokers who is a great BayCare fan and just a great person to work with wanted me to remind people that you want to make sure you're going to your primary care physician for your annual visit once a year. You don't want to lose your established status. Doctors get busy and you want to make sure that you can kind of keep that way. I always try and make my appointment when I walk out the door for the next year. Sometimes I've actually done, when the doctor will let it, do 2 years out. So I'm constantly looking at 2 years so I don't forget to do that, because it is sometimes difficult to get in. And then when you start looking at some of your specialties, I happen to be a chronic migraine sufferer. So I know, I went around to a lot of different neurologists to find the neurologist who I connected with, who listened to me and I understood, but I make sure I keep my appointments, going so that I don't have any issue getting back in with them.
It's a great point, Jean Marie. I say from the poll, we got about 31% working between 40 and 50 hours. Not too bad, but that 12% above that 51-hour time frame, a little concerned with you guys. Make sure you're taking care of yourself.
That's when they need you, those moments of health. Keep doing things that keep you healthy. We are just about coming up on time. If you have a question, go ahead and type it in. But for those of you who are on our mailing list, you will be getting the follow-up of this presentation. We'll send you the PowerPoint and a couple of tips. We also, you'll see above in the chat, we have the link to where you can listen to the previous titles. They are a couple months behind, so this one will not be up for a little while. But if you want to go back and hear something that you might have missed, if you are not on our mailing list and you would like to be, I have dropped my email address in the chat. If some friend of yours sent you this and you don't have my email, go ahead and send me an email and I'll make sure that you are on the email list for this.
And I love the comment in here about they see a physician within the BayCare Medical Group, and they're very happy and love to send positive feedback. Let me tell you, folks, positive feedback is killer for a physician, for their staff. It really brightens our day, and so I know they have the Google reviews. They do they have some surveys that go out afterwards as well. But just dropping a card to your patient or to your provider and saying, hey, thank you and your staff for the great work and job that you're doing. That's so appreciative. Those cards get posted in the back lunchrooms of the clinics. They get shared with the medical directors, and they do filter their way up to our leadership as well. We always love the positive. We're not perfect, but we love it when we get positive feedback. It really warms our heart.
Do you have an easy place for them to do that at? I mean, should they call the office to get that, or is there a place online?
Yeah, the Google reviews are what most people are doing. We follow that to some extent, but there are specific surveys that come out. They only go to a percentage of the population that are seen. And if you're lucky enough to get one of those surveys, take the time to complete that. Otherwise, like I said, just send a thank you card to the office. You're taking the time to send that card, allows you to connect. It'll make your happy hormones feel a lot better and elevate, but they're receiving it tenfold on that as well. So that's a plus plus. It's a win-win. Those are the best things in medicine.
I think it's awesome when we take time to write a handwritten note too. I think that's a dying art, and that definitely goes under that gratitude moment. And thank you, Bernadette. Bernadette says that with BayCare, you will get a survey from your appointments going out. Is
Yeah,
negative feedback?
negative feedback is just as important. But I always like negative feedback to be somewhat constructive. What was it you didn't like? And what was it that the people of the clinic could impact? I read a lot of that stuff. I follow all of that, all of the negative stuff. It's kind of my day. But you know, I understand the sidewalk's crooked, but you're dinging the physician for the crooked sidewalk. You know, you're giving them a 3 because the sidewalk is crooked. They didn't lay the concrete. You know, a clinic that's dirty, yeah, bring that to our attention. We want to make sure that our housekeeping and whatnot are taking care of that. If there's a provider or a staff member that's rude or curt, we want to know about that because that doesn't exhibit our values within BayCare. Those are the things we really look at. It's interesting how some of the negative stuff that we see, physicians will see it on Google, they'll see it on Yelp, they'll see it on Facebook. People are kind of like these ninjas, right? They'll put it everywhere. I know in my time growing up, and I'm not trying to date myself, but there are things that I see people say to others on social media that if they ever said it to another person's face when I grew up in the 70s, you just get clocked, right? So I understand the bravado and the strength that those medias have given some people as far as a voice. But I really think when we have negative feedback, what's really important is to help us understand what it is was the problem, and you know what it is that we can do to potentially even fix it, because we weren't there. We're not at every clinic, we're not following everything, but I can tell you negative ruins the day of the staff and the physician. There's no two ways about it. Anytime I ever got negative feedback, even when it wasn't valid, it really puts a damper on your day. It's not a warm and fuzzy feeling, and we don't blow that stuff off. We really take it home with us, unfortunately.
We are a little over time, but I'm so if anyone needs to leave, I please go, and we thank you so much for being here. There was a question here, and I think a lot of people feel this, and I think there's some reasons behind it. So I was wondering if you could just address for those who can stay is, sometimes when you go to the doctor's office, because of the way they have to input so much information into the computer, sometimes it feels like they're looking at the computer more than really addressing you. And I know that's not always the truth, but it is definitely the perception. So it's what are some thoughts that you have on that?
Yeah, if you were to look at the screen that our staff are having to complete, it's all over the map. They're trained how to do it and follow it, but it's not like it's all in order. You're putting things here, you're putting things here. So there's some controlled chaos within that environment. In addition, they're trying to gain this information, trying to understand the information, kind of go through it. Be patient with them. And I have the same experience as many do. I see 3 physicians, and I happened one day to see all 3 physicians on the same day, believe it or not. And so I see the first physician, and they ask me for all the information. Their staff asked me for all this information. I give it all the information. Get done with them. A couple hours later, I see another provider within BayCare, same organization, and they asked me for all of the same information again. So I'm like, all right, that's not too bad. So I give it all to them. And then later that evening, I'm following up with the last provider, and they asked me for it a third time. So I share your frustrations, but I also understand they need that information. And that's what I was telling you. Computer systems today, whether it's BayCare, TGH, Advent Health, you name the organization, and these electronic medical records are a challenge. They are very cumbersome to work within. So be patient with those folks. They're doing the very best that they can. Mistakes can happen. They're really trying to be exact in what they do. And so they may ask you 2 or 3 times for a spelling of a name or to repeat a number. It's sometimes hard to hear people in a busy clinic. And so just be patient with those folks. They're doing the very best that they can, and they really have your interest at heart. They really do.
Thank you, everyone. Dr. Kolovos, thank you so much for sharing your time and your expertise and your passion with us. It is always a pleasure to get to hang out with you. And it obviously, from all of the thank yous in the chat, you can tell that most people here were also very happy to get to know you and spend some time with you. So we wish all of you a awesome rest of your day. And let's go follow those 3 tips by do something nice for someone, say something nice. Move speaks to my heart. Get up
That's
and move
it.
and do a little bit of this or that. And, write down or document what you're grateful for. It really does change your mood. Have a fabulous day, everyone.
Take care, everyone. Thank you again.